Hi, my name is Daniela Parrales and I'm going to talk about a randomized trial of progesterone in women with bleeding in early pregnancy. The definition: bleeding in early pregnancy is strongly associated with pregnancy loss. The progesterone is essential for the maintenance of the pregnancy. Several small trials have suggested that progesterone therapy may improve pregnancy outcomes in women who have bleeding in early pregnancy.
Pregnancy causes your hormones to change quite a bit. There's a really strong surge of progesterone, which is the hormone that we notice right before we get our period, where we might be a little crabby, feel bloated, and that hormone shoots up when we're early in pregnancy. And so you can notice that you might be very crabby or tired or moody.
Sometimes people don't have any of those signs, and that can be a normal sign of pregnancy.
Fortunately, my pregnancy has been a lot easier than I expected. I just had hormones and mood swings the first 3 months, and then after that it's been normal. I felt like myself, really.
So usually in a normal pregnancy, there's no need to monitor pregnancy hormones. Sometimes, very early in the pregnancy, if you have bleeding or pain or other complications, we may check blood levels for pregnancy hormones to ensure that they're increasing in a normal way, and that can help us predict what may be going on with the pregnancy.
Now, the application in medicine. Progesterone, which is produced by the corpus luteum in the ovary, is necessary to prepare the endometrium for the implantation of the embryo and thus is an essential hormone for a successful pregnancy. Subsequently, beginning at the approximately 12 weeks of pregnancy, the placenta becomes the dominant source of progesterone.
And may I reassure you that most of these are of no real problem to you. The main reason that you can bleed in the first trimester is something called breakthrough bleeding. Now this occurs at the same time as your menstrual cycle will occur, and it compensates and carries on like little dust spotting until the hormone levels reach a certain level when it will subside. The second type of bleed is an implantation bleed, which is when the fertilized egg embeds into the side of the womb. And this just occurs one-off, and it's like slight spotting, but obviously of a concern to you. The third other type that's not really of anything to worry about is something called a cervical erosion. You might not even know you have this, but because the pregnancy hormones are at such a level that they cause the cervix to soften, during intercourse you might find you have this spotting. If you have any type of bleeding and you are obviously concerned, go along to your early pregnancy unit. There they can do blood tests and urine tests to check the pregnancy hormone levels. They will also do an ultrasound scan, and they can check for the fetal heart. This will help to reassure you that the other more serious concerns, such as an ectopic pregnancy or a threatened miscarriage, aren't going to happen.
Now the pros and cons. As a pros, we have the prevents miscarriage in asymptomatic women who have a history of recurrent miscarriage. And the second one is rescue pregnancy in women who have started to bleed during the early pregnancy. And the cons, the treatment with progesterone did not result in a significant improvement in the incidence of live birth among women with vaginal bleeding during the first 12 weeks of pregnancy.
Will end in miscarriage. The most common cause of pregnancy loss is chromosome. 10 to 25% of all clinical pregnancies will end in miscarriage. The most common cause of pregnancy loss is chromosomal abnormalities, which means something is just not right with the baby's DNA. This type of loss is not preventable. Other common causes of miscarriage include hormonal problems, infections, and structural problems within the mother, and can sometimes be prevented. Your doctor can check your cervix and uterus for any abnormalities, screen you for clotting disorders that can prevent implantation. Make sure you are current on all your vaccinations and check your hormone levels. Diabetes, low thyroid, and low progesterone can all cause pregnancy loss. Things you can do at home to prevent miscarriage include 1. Not smoking, drinking alcohol, or using drugs. 2. Maintaining a healthy weight and keeping diabetes under control, and monitoring your progesterone levels with urine progesterone test strips.
Issue of play in Ecuador. It's necessary to continue evaluating this pharmacological treatment to implement in Ecuador because there is no evidence to support the indication routine of the progesterone in prevention of miscarriage in the first half of pregnancy. And finally, the conclusion, we have that the progesterone therapy in the first trimester of pregnancy did not result in a significantly higher rate of live birth among women with treatment miscarriage overall, but an important subgroup effect was identified.
Good afternoon. My name is Dr. Josh Skorupski. I'm one of the reproductive endocrinology and infertility doctors at the Center for Reproductive Medicine at the University of Michigan. And we are lucky enough to recently have begun a fertility blog and are trying to have a greater presence on the web regarding fertility and infertility practices. And we have since received a series of questions regarding a variety of questions for fertility issues, and one of which has come up to be actually a common question, which is regarding levels of progesterone. And essentially, progesterone is a hormone that's produced after ovulation, and there needs to be a particular level of progesterone in order to sustain pregnancy. When progesterone levels are low, there is some thought that that can potentially lead to things like recurrent miscarriages. We usually check that level at a particular time in the cycle, and then thereafter, if it was low, we can then give a variety of medications to help to try to correct that. If and when there is a problem like that, there are a series of medications, like I mentioned, from just supplementing with things like progesterone on its own to helping with medications that help you produce more than one follicle, like oral ovulation medication.